I grew up believing something that I think most Canadians believe. If you need a medication to stay alive, like insulin, it's covered. That's what universal healthcare means, right? But in my class, I learned that legally that belief is actually not guaranteed at all. And insulin is a perfect example of the difference between what feels true and what is legally true. In Ontario, approximately 2.4 million Ontarians are currently living with diagnosed or undiagnosed diabetes or prediabetes. By 2034, it's estimated that over 3 million Ontarians, like 17% of the population, will be living with diabetes. So, importantly, the prevalence of diabetes is 2.1 times higher among adults in the lower economic status group compared to those in the higher economic status group. It does affect the populations disproportionately. The truthiness is simple. Canada has universal health care. Insulin is life-sustaining. Therefore, insulin must be universally covered. Let's start with the Canada Health Act. Under Section 7, the Act sets out 5 criteria provinces must meet to receive federal health transfers: public administration, comprehensiveness, universality, portability, and accessibility. Under Section 2, the Act defines insured health services as hospital services, physician services, or surgical dental services performed in hospital. It does not include outpatient prescription drugs. That means the federal government does not legally require provinces to universally cover insulin outside of hospital settings. Federalism matters under the Constitution Act of 1867, Section 92, gives provinces jurisdiction over hospitals and matters of local nature. Healthcare delivery, including prescription drug coverage, is primarily provincial. So, whether insulin is covered depends on provincial programs. There is no automatic national entitlement to outpatient medication coverage. Aww. In Ontario, public drug coverage is governed by the Ontario Drug Benefit Act. This act is a program that covers insulin for seniors aged 65 and over, individuals receiving social assistance, and those enrolled in the Trillium Drug Program. But if you are a working adult under 65 without private insurance, you may still face deductibles and co-payments before public coverage applies. Coverage depends on eligibility categories, not simply on medical necessity, and insulin itself is only part of the picture. Ontario's Assistive Devices Program funds insulin pumps and provides up to $2,400 per year towards pump supplies. However, pump supplies can cost between $3,000 and $3,600 annually, meaning patients may still face out-of-pocket costs, even when they qualify for assistance. So, access exists, but it is structured, conditional, and income sensitive. That is legally significant. Many people assume that Section 7 of the Canadian Charter of Rights and Freedoms, which protects life, liberty, and security of the person, guarantees access to life-saving medication. But Canadian courts have been cautious. Section 7 primarily protects individuals from state interference, not from gaps in public benefit programs. There is no explicit constitutional right to state-funded health care. So, even though insulin is essential for life, there is no direct constitutional guarantee that it must be publicly funded for every resident. Now, this matters because it's not just about insulin. It reveals something deeper about Canadian healthcare law. We often describe healthcare as a right, but legally, it is structured as a publicly funded program defined by statute, funding arrangements, eligibility criteria, and provincial policy decisions. And when diabetes prevalence is significantly higher among lower economic status Ontarians, the very group most sensitive to the out-of-pocket costs, the limits of that program structure matter even more. The Canada Health Act creates funding conditions. It does not create enforceable personal rights to comprehensive treatment. The truthiness is that universal health care means comprehensive access. And the truthfulness is that universal in Canadian law is much narrower than we assume. So, insulin shows us that in Canada, healthcare feels like a right, morally and culturally, but in law it remains a structured public program, and that distinction matters.